This portion of Local Lifestyles is sponsored by Ackerman Chiropractic and Fitness Center.
And Dr. Dwayne Ackerman is here with us today to talk about a subject that really does plague so many tri-staters, and that's neuropathy. What exactly is it?
Great question. Neuropathy it's a life-changing situation for a lot of patients. And there's a whole list of symptoms, but to answer your question, I got two quick little stories.
Okay.
This past fall, I went into a follow-up patient, and the patient was crying. And I'm like, oh my gosh, you know, what's going on? So I sat down with her and said, well, what's happening? She said, well, I walked through my kitchen floor this morning and I stepped on the back of an earring, and she said, I felt it for the first time.
Oh, that's a happy story.
It
yes.
was. They were tears of joy, which was a big relief for me.
Right.
But she said something I didn't tell you when we first met and started talking about this was, I was walking on my kitchen floor and I saw blood everywhere. And she said, I cut my foot and didn't know it. And so the loss of sensation is a big problem for a lot of people. And it's a scary situation because you hate to go out anywhere because you're unstable and that type of thing. And another quick one was a patient that came in and he said, I want to golf again. This was a 90-year-old gentleman.
Oh, how wonderful.
Still super fit, but he said, every time I come up, and he came in using a cane, his putter was his cane.
His cane, okay.
So he comes in and he says, every time I take a putter swing like this, he said, I fall down.
Oh.
And he said, I can't risk breaking hips.
Sure,
that type of stuff. Fall risks for the older is a big deal. And he said, I want to play golf again. And at the time, he was one of the worst patients symptom-wise that we'd ever had. And about 9 months later, he was able to play a little bit of golf. So the loss of sensation, the loss of balance are some of the big symptoms that people have and scare people because they're told there's nothing that can be done about it.
Right.
And it's great that we can do something about it because the patients that come to see us, they've been everywhere. They've been to their family docs. They've been to the orthopedist, the neurologist. They've been to Mayo Clinic, Cleveland Clinic. They've been everywhere and told there's nothing that can be done. And, you know, the program that we use helps very, very well in most cases.
And I'm going to guess the sooner you start, the better with this treatment, when you first have those sensations?
Ideally, yes.
Yeah.
Most people don't.
Of course.
You know,
of course.
The symptoms probably start 10 years before they ever see me. You know, they go through denial and I'll try this, I'll try that, and take the different medicines. And by the time they get to me, they're really frustrated because it's getting worse. They know it's getting worse, and they're searching for answers. And it's wonderful that we can help most of those patients.
Well, it's got to be exciting for you to have those stories when people can
it's
really renew their lives.
It's a blast to practice. When you come in and you get to see patients, you know, and they smile like you're smiling now because, like, I can do something. I feel more confident. I feel like I can go walk, I can go to the mall, I can go to the store, you know, and not feel like I'm going to fall and those type things.
Well, that, as they say, is a big deal. So if we are having these symptoms, the best thing to do is just make an appointment and have an assessment.
Correct. And I think they showed on the screen the thermal imaging of a normal foot and a neuropathy foot. So what we're offering for your listeners and for your watchers, I guess, if you just call our office, tell her you saw this segment, we'll do an absolute free consultation. We'll do a thermal imaging of your foot, and we'll know right away if you have neuropathy and if we can help. And then if so, we'll discuss options, because we've got about 7 different options that we can use. Some people only need one, some people need all of them. Everybody's a little bit different.
That's why we want the options. Oh, and that's why he's a tri-state professional. Thank you. It's always good to see you.
Thank you.
We'll be back with more Local Lifestyles right after this. Stay with us.
This portion of Local Lifestyles is sponsored by Ackerman Chiropractic and Fitness Center.